Welcome to the Plan of Care Compliance and Reporting Training, produced by Jan and Bev's Home Care for Personal Care Aid in Service Training. This training is mandatory and focuses on your responsibilities related to the Plan of Care, which is the most important document guiding the care you provide to every client. This training is being conducted to ensure full compliance with New York State regulations and agency policy, and to make sure that you understand your role in providing safe, effective, and compliant care. This training is designed to ensure compliance with regulatory requirements while supporting efficient and appropriate communication between you, supervisory staff, and our clients' care teams. The goal is to ensure that significant client needs are addressed promptly without creating unnecessary reporting burdens for routine or non-impactful observations. By the end of this training, you are expected to follow each client's care exactly as written, recognize and report any changes in your client's conditions, understand what you can and cannot do as a PCA, and know when and how to report concerns to the RN supervisor. This is not optional. Failure to follow these requirements can result in harm to our clients and possible disciplinary action.
What is the Plan of Care? The Plan of Care is a written document developed by a registered professional nurse. It is based on the client's condition, needs, and physician's orders. It tells you what tasks you are assigned, how to perform those tasks, what the client's limitations are, and what safety measures must be followed. It is your responsibility to locate the Plan of Care at every visit, review it before providing care, and follow it exactly as written. You are not allowed to change tasks, add new tasks, skip tasks without reporting, or perform anything not listed. Take a moment to think about what you would do if a client asks you to do something that isn't on the Plan of Care. If a client asks you to do something that isn't on their Plan of Care, you should not perform the task. Even though you do not create the Plan of Care, you must understand what it includes so you can follow it properly. Key components include personal care tasks, such as bathing, dressing, toileting. Activities permitted, functional limitations, which are activities that the client cannot do safely. Mental status, such as alert, confused, etc. Nutritional needs, such as diet and appetite concerns. Safety measures, such as fall risk and supervision needs. Equipment, such as walker, oxygen, etc. And special instructions. These sections help you understand how to safely care for your clients.
One of your most important responsibilities is observing your clients and reporting changes. You are the eyes and ears in the home. You must immediately report changes in breathing, changes in mental status, changes in mobility, skin issues, poor appetite, pain complaints, and behavioral changes. You are not expected to diagnose, only to observe and report. You are not expected to report every minor observation. The focus should be on recognizing when something represents a meaningful change, a safety concern, or an issue that affects care delivery. For example, a single refusal to bathe requires you to only document the refusal. Repeated refusals to bathe that affect the client's hygiene require you to report the refusals per agency policy. A client who has sudden weakness or confusion requires you to report the change in the client's condition immediately. Appropriate judgment is expected, however, over-reporting of minor issues is not required. You must report symptoms related to the client's conditions. For example, if a client has COPD, you must report shortness of breath, increased coughing, and difficulty breathing. If a client has dementia, you must report increased confusion, wandering, and behavior changes. Even if you're unsure, report it. Some clients have oxygen or medical equipment. You must be aware of the ordered oxygen flow, such as 3 liters via nasal cannula. You must also make sure equipment is positioned properly, and report any issues immediately. You are not allowed to adjust oxygen levels, turn oxygen on or off, or perform skilled tasks. If something looks wrong, report it. You are required to document the tasks you complete at every visit, tasks that client refuse, and your basic observations. You are not allowed to write diagnoses, interpret symptoms, or make clinical judgments. For example, if your client refuses to bathe, you can report, quote, client refused shower. You cannot report, quote, client depressed and declining. Missing information in a plan of care, such as nutritional requirements, can be dangerous. However, your responsibility is to still follow the plan of care as written, and report concerns. Let's review the most important points of this training. Always follow the plan of care as written. Never perform tasks not listed. Always report changes in client condition immediately. Never adjust medical equipment. And remember, you are not a nurse. You can only observe and report. Your role is critical for keeping our clients safe. Thank you for participating in this training. To receive credit for completion, you must successfully complete and submit the accompanying online test. Please proceed to the test at this time.